Hey everybody, hey, this is Dr. Ty. Let's talk about neuropathy and decompression. I had this question the other day, and I wanted to share what this patient was asking. They're like, "Hey, Dr. Ty, can decompression therapy help my neuropathy?" Now, first, let's actually understand a couple things first. Let's understand decompression therapy and understand neuropathy. Well, decompression therapy is when you have what we call a disc bulge or a disc herniation. That's basically where you're squeezing down and pinching on the disc to where now that disc bulges out and either puts pressure on a nerve and or the spinal cord. And what happens is now that nerve starts to lose its function. It stops to lose the ability to work. And as that happens, you start to develop pain, you start to develop tingling and numbness and muscle weakness. It could be a lot of different things. And so when you look at what neuropathy is actually deterioration or destruction of that nerve damage, right? So a lot of times what I've seen in all the patients that I've seen with neuropathy and disc herniations is that now you have multiple issues. You have damage within the spinal cord, but then also you have damage within that nerve where you're having those symptoms at. So you could have damage in the spinal cord and damage in your nerves, and now they're not one problem, they're actually two separate problems now. So decompression can be beneficial, but you might not see the issues in your feet go away. And more often than not, that's kind of the case. And again, the reason why is now that problem has become a separate entity. So you could try it and see if it helps, but my feeling is the opposite. We should work on those nerves first. Let's see if you can get some nerve changes. And if you don't, then I think then is a good route to go on to see if you can decompression therapy. Now, doesn't mean that if you do it, you might not see results. It's just I logically have to go through my mind and say, okay, if I have separate problems, well, and again, this is saying if you're not symptomatic in your lumbar spinal cord, your lower back. If you're symptomatic, then yeah, you probably want to do everything at that point. But the realization is, if anything, you have to do something. The only time neuropathy ever wins is when you do absolutely nothing. So the answer to the question, can decompression help? Sure. Will it help? I don't know. Again, depends on those problems. What I would do, I would explore everything and see from there. All right, guys. Hopefully that helps. This is Dr. Ty, and take care. God bless.